Okay, thank you very much, Yusek Eric. And once again, in behalf of the DOH, I welcome you to our daily press conferences. And this is the second one, beginning yesterday. And today, the DOH is confirming that a 38-year-old female Chinese patient under investigation, or PUI, is positive for the novel coronavirus 2019-nCoV after her lab results arrived today from the Victorian Infectious Disease Reference Laboratory in Melbourne, Australia. The DOH, however, continues to guarantee the public that all necessary precautionary measures are being taken to halt the spread of the virus. The confirmed case arrived in the Philippines from Wuhan, China, via Hong Kong last January 21, 2020. The patient sought consult and was admitted in one of the country's government hospitals last January 25 after experiencing mild cough. She is currently asymptomatic. So let me repeat. She is currently asymptomatic, which means she has no fever, and no other signs and symptoms suggesting illness at this point. I assure that the public that the DOH is on top of this evolving situation. We were able to detect the first confirmed case because of our strong surveillance system, close coordination with the World Health Organization and other national agencies, and the utilization of DOH's decision tool or the evaluation assessment tool. We are working closely with the hospital where the patient is admitted and have activated the incident command system of the said hospital for appropriate management, specifically on infection control, case management, and containment. We are also implementing measures to protect the health staff providing care to these patients. DOH is also in close coordination with the Interagency Task Force on Emerging Infectious Diseases, or EID, which includes representatives of the Departments of Foreign Affairs, DFA, the DILG, Interior and Local Government, the Department of Justice, the Department of Labor and Employment, the Department of Tourism, the Department of Transportation, as well as the Department of Information and Communications Technology, or DICT. The task force will convene a high-level meeting tomorrow, January 31, 2020, to discuss the first confirmed case and developments arising from these health events. The Bureau of Quarantine remains on high alert and is in constant coordination with authorities from all ports of entry for stricter border surveillance. DOH assures that its health facilities are equipped and prepared to receive and care for PUIs, as well as confirmed 2019 nCoV cases. DOH has recorded a total of 29 PUIs, 18 in Metro Manila, 4 in Central Visayas, 3 in Western Visayas, 1 in Mimaropa, 1 in Eastern Visayas, and 1 in Northern Mindanao, and 1 in Davao. 23 PUIs are currently admitted, and 5 have been discharged, but are still under strict monitoring. DOH also reported 1 PUI mortality yesterday. We did that. Finally, I urge the public to stay calm and remain vigilant at all times. Let us continue to practice good personal hygiene and indeed adopt healthy lifestyles. Thank you.
Okay, we have, please, no one question each. Tina.
Sir, how is the contact tracing now?
Yes, good you asked. I would like to invite in Director uh, Chito Avelino of the Bureau of, no, the Epidemiology Bureau. Chito, please.
Thank you, sir. With the information that we gathered this morning from the result of the laboratory, we have coordinated this time with the Bureau of Quarantine and the CHD of Region 7. What we did with BOQ is that with the, we requested for the flight details, kung ano yung mga flight carriers na sinakyan ng pasyente at saan pumunta, tinitignan natin yun. That is after we have gathered the information from the patient as to what were the flights they took. Aside from that, we also coordinated with the CHD Region 7, and we are looking at the places where they'd been to in Cebu and in Dumaguete. Once we have seen or we have the list of these places, then we do the contact tracing. For the plane, we do the rules of four. That means we need to identify passengers, 4 passengers front, 4 passengers at the back, and 4 passengers on both sides. Then we contact these passengers and advise them accordingly. But for the community, we are looking at the establishment where they stayed and advise the establishment owner to identify the employees that had been in contact with the patient, and from there do the mandatory quarantine to observe them if ever they will manifest any signs and symptoms of respiratory infection.
Left.
Yeah.
I'm surprised because we don't have that information either. We don't know how they arrived at that estimate. As you know, estimates are only estimates. We don't know what basis they used for the arriving at the estimate. We don't certainly have that information. As the secretaries mentioned, there are many patients that are considered PUIs, in fact 29, but not only one of those have been confirmed. Many others have been excluded because the tests have come negative. So I have no information as to how this institute arrived at this estimate.
Dr. Gan, do you have additional information about the novel coronavirus? Is it a mild virus, or what's the survival rate at this point?
So we are reiterating the most recent numbers issued by our headquarters last evening was 6,065 cases reported to WHO with 132 deaths. More recently this morning, the Chinese have reported further increases in numbers and deaths, which have not yet, I believe, been reported to WHO. But among all of these cases, as you see, there's only 132 deaths that have been reported. If you're looking at a mortality rate, you're talking of less than 3% deaths. This is much lower than previous coronavirus infections, just so that we look at it from a realistic perspective.
To Dr. Radley, sir, the WHO officials at your headquarters will be meeting today to discuss the global health emergency declaration. If indeed they declare the global health emergency for nCoV, what does that entail? What are the implications?
So you're correct. The DG has asked for a reconvening of the emergency committee of the international health regulations that will be relooking at the novel coronavirus situation. Part of this is because of the increased number of cases that are being reported in China, but also increasingly beyond China. I believe we have now confirmed cases from 15 other countries. So this changes the situation from the time the committee met on the last occasion on the 23rd, and they will be looking at whether this current situation and the evidence and knowledge that has been gained since the last meeting now constitutes enough evidence to classify this event as a public health emergency of international concern. Let me explain that. What would that mean? If WHO then decides to classify this as an international emergency, a public health emergency of international concern, it would then mean that we would work with member states to actively stop the transmission of this virus, and that may include restrictions that are agreed with member states to facilitate that process. What those restrictions are, we cannot tell, and that will be based on the risk assessment and the conclusions that the committee reaches this evening. But the aim of the declaration is to prevent the further spread of this disease and to control it as early as possible. So the reproductive rate, the number that we look at to define the infectivity of an infection, in this case is lower than for SARS. The numbers have improved, reflecting the increased preparedness and readiness of the Chinese and the early start to the testing of people. So we have to look at it in that context and not purely compare numbers, right? We are talking 17 years later, enhanced preparedness and capacities, and larger populations. So we would have expected to see more numbers. That doesn't actually mean that this infection probably is more infectious than SARS. The numbers that we have currently does not support that.
Well, that has obviously changed by now, and that is why I will strongly recommend to the task force, the Emerging Infectious Disease Task Force, of whose members that I already enumerated, a temporary restriction of travelers from the entire Hubei province of China. But I believe that will still change. It could expand the number or increase the number of places depending on the assessment that is going to be done by the WHO. So we will be waiting for the assessment of the WHO and recommendation whether to add to the list some more places with a relatively higher burden of nCoV infection. Okay? So this is going to be dynamic. Yes, well, that is assuming they haven't traveled to any of the affected places in China. So you and I, it's the season of flu. every now and then, we develop coughs, colds, slight fever, weakness, body malaise, etc. And what I have been saying is to make sure that we should be very conscious about personal hygiene, such as washing of the hands for 20 seconds, palm and at the back of the hands and the digits, make that 20 seconds, and we recommend as often as you can. If not, if you have alcohol, you apply alcohol on your hands, on your palms, and then the cough etiquette, the maintaining the distance of not less than 1 meter apart from the next guy in front, at the back, or at your side. And the hydration, drinking a lot of water, because as I have read yesterday in some articles, it appears that the virus will be difficult to inactivate in low temperatures and low humidity or dry atmosphere. So having said that, therefore, I strongly recommend as your doctor that you have to drink a lot of water, make sure your throat is moist so that the virus doesn't attach to it and gets eventually absorbed. And then, of course, the intake of nutritious food stuff rich in vitamins A, C, D, E, and also mineral zinc. You can get that included in the multivitamins that you take. Instead of iron, you deliberately point out to those that with zinc, kasi that's been proven to protect the throat. Drink a lot of fruit juices rich in vitamin C. Eat put malunggay in many of your soup or other food stuff, and avoid crowded places as much as possible. And if you are feeling any of the symptoms I have just mentioned, do wear a surgical mask. It's going to help prevent the spread of whatever virus you have. This is not just talking about nCoV, but you have alpha influenza virus, you have the beta influenza virus, you have the streptococcus pneumoniae, you have the Haemophilus influenza, and also even some opportunistic microorganisms. Huh? Because if your resistance is weak, then even the ubiquitous organisms that we breathe every now and then will tend to cause disease in people with very poor immunity.
Take two more questions. Sir, yun lang pong detalye sana nung na-confirm natin case. Ito po ba yung kasama dun sa pinigil sa Hong Kong? Tapos po
Yung unang naibalita na grupo ng Chinese national na galing sa Hong Kong, iba ito.
you can ask the director of the national later. Is there. Last question, please.
Additional information about the patient. The patient is a nila original the generic.
In Manila. Okay, thank you.
Thank you very much, everyone. Thank you.
Manila City, Centro
At yan po ang naging pulong balitaan ng Department of Health kaugnay sa 2019 novel coronavirus. Kinumpirma po ng Department of Health na may isa ng kumpirmadong kaso ng novel coronavirus sa Pilipinas. Isang 38 anyos po na babae ang kauna-unahang kumpirmadong kaso ng nCoV na galing sa Wuhan at China. Dumating siya sa Pilipinas via Hong Kong noong January 21. asymptomatic o hindi siya nakitaan po ng sintomas. Hindi rin ho daw siya nagkalagnat ayon yan kaya Department of Health Secretary Francisco Duque III. Pero tiniyak po ng DOH na they are on top of the situation. Patuloy daw sila nakikipag-ugnayan sa World Health Organization at tinitiyak na mako-contain ang sakit. Ayon naman ho sa WHO, meron na raw 15 bansa ang kumpirmadong merong coronavirus at dahil dito, pinag-aaralan na ng WHO ng pagdedeklara po ng Public Health Emergency of International Concern. Muli pong paalala ng Department of Health dahil po sa meron ng kumpirmadong kaso ng nCoV dito sa Pilipinas, panatilihing malinis po ang kamay, maghugas ng kamay at maglagay ng alcohol hanggat maaari at itaas daw po ang intake ng vitamin C. Kumain din ng maraming malunggay at iwasan ang matataong lugar at kung maaari maglagay o magsuot ng face mask. At